No, I want just... Well, hello. Sorry about this. I'm having some technical difficulties. And suddenly my Mac's not working. So I'm having to improvise, and I'm on my phone. So I do apologize for the delay. And I'm going to have to somehow show you my slides, which are on my Mac. Oh, I've put so much work into these lovely drawings, so I'm a bit gutted about that. But welcome everyone, sorry for the delay. My name is Dr. Claire. I am the medical director of the Cannabis Clinic, which is based in Auckland, but we have doctors around the country as well. And it's my pleasure tonight to welcome you to my first Dr. Claire's Cannabis Corner. Oh, it's so nice to see people hopping on. Hello, Jonathan. So tonight I am just going to be going into the real basics of cannabis medicine, and I'm only going to be talking about just very tiny snippets at a time, so that it gives you lots and lots of room for questions and answers, because I know everyone's always got lots of questions. And as the weeks go on, I will fix my technical difficulties, whatever they've been, with my my proper computer, as it were. So I'll be able to share some lovely slides with you, and I will do my best to share them with you tonight as best I can. So, so what I'm going to talk to you about tonight. Yeah, good. Sorry, I'm just getting feedback from my husband. So what I'm going to talk to you tonight about is, why does medicinal cannabis work? And I know that those of you who've seen me as a client will have got my spiel about how it works. So if that's you, bear with me and enjoy the re-spiel. And so I'm going to illustrate to you why medicinal cannabis works in your body. And my goodness, what an amazing mechanism it is. So I'm just going to turn my screen around. And you were going to be treated to some really awesome pictures. Hang on, I might just turn my... Oh, hang on, I can't do that. Right, okay. So we're going to start off with the basics. Now, the wonderful thing is that you, my friend, are making your own cannabinoids. Oh, no sound. This is not good. Can you hear me okay? Can someone tell me if that's better? Have you got sound now? Okay, all right, okay. All right, so you are making your own cannabinoids, and here they are. They're little dudes running around. Imagine that. I do like to think of things in the body in terms of little dudes. Since medical school, it's helped me to remember stuff. So you've got these little guys running around. And they're pretty awesome, because what they're doing is something very, very special. They are cell messengers, and cannabinoids, here he is, he's got his little message in his hand. Cannabinoids work really, really, really hard all the time. Oh, thank you for the feedback, you guys. That's great. You can hear me. Awesome. And what they do is they form a network around the whole body. And they form something called the endocannabinoid system. So here they are, they're like a little relay team, and they pass on information around the body. Now, no one ever told me about the endocannabinoid system. I don't know about you, but even going through medical school, I never got told about it. Now, the amazing thing is that this thing works like a radar. And you can tell that I had a lot of fun drawing this, can't you? Because it's just really cute. And here he is. Here's our little radar. And this is your endocannabinoid system. And he's got his, I don't know if you can see that there. He's got his little cup of cannabis tea there, I'm sure. And there he is with his big red button. Or equally, it could be a she, all right? So there's your little radar system. And so these cell messengers, they form a network through the whole body. And their only aim... Oh, yeah, sorry, Craig, I can't go landscape. It's not letting me do it. I'm so sorry. Next week is going to be just eons better, okay? So anyway, so these things are forming this network, and his only wish, that little guy, is to keep you feeling good. and he'll do anything in his power to make you feel good and to overcome any imbalances in the body. So all the time he's sitting there, you know, looking for any imbalance. And then when anything does go off, then the red button goes off too. So the red button goes wah, 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 wah. And so what it does then is it alerts whatever system's going wrong to the fact that it's going wrong, and that system will correct the imbalance. So it's an amazing self-regulatory system. And what it does is it is always scanning you for pain, for stress and anxiety hormones, for inflammation, which, as you know, is the big driver of disease. It regulates immune function, so any naughty immune cells that are going on helps to knock those on the head. It regulates gut function, appetite, hormone balance, regulates tumor cell regulation. So if there's any, you know, naughty, precancerous or cancerous cells going on, tends to knock them out. It maintains your bone mass, something that we don't even really think about. And it also has cardiovascular effects. So this little endocannabinoid system is just the cleverest little thing you can imagine. Now, what happens if something really, really bad is going on in the body, or you've got chronic stress, or you've got an inflammatory process? And so many people I see have got horrible health problems going on. And you can imagine that your little radar system, all those guys in that room, you know, who are trying to keep you on an even keel, have got little red cheeks and a sweaty brow because they are all the time trying to correct what's going on. So you can just see, oh, it's really tragic. Here he is with his little tears, and this is your unhappy or depleted endocannabinoid system. So you can imagine if that's not working well, then you're not going to be keeping as well in balance as you would have done if it has been working well. So you got to think Texan kind of, you know, coming to the rescue. We've got THC. And I've no idea why I drew THC as a little cowboy, but it kind of just came out. He's a bit cowboy. And I'll let you know all about THC next time we meet. But here's little THC. And here's CBD. And I thought you might appreciate her little cherry hat. And CBD, I drew her like that because personally, I feel quite in love with CBD. It's the most amazing cannabinoid. And it seems to do well for most people. So there she is, looking all cute. So these two will come in and top up whatever's going on in that radar room for you, so that, you know, your system starts working better. So in a nutshell, really, that's what medicinal cannabis does. It treats your endocannabinoid system. And that's why when we treat that, we can treat a whole bunch of different things, really, with just a couple of medicines. You know, you wouldn't think it was anything, but we get the most profound results, or can do, with just correcting the endocannabinoid system. So I know lots of you have got, well, you've all got your own story around cannabis, and my goodness, there's just so much to share. And next week, I'm going to be, or in the next couple of weeks, I'm going to be talking about how we use cannabis as medicine. So I'm going to talk a lot more about these little guys. I really hope that you enjoy my cannabis plants that I drew there. I'm learning all about cannabis, including how to draw it. So we'll be talking about these two little guys and how they interact, and how they work, and how you take them. So it's question time. And you can just fire away the questions, and I'll see what I can do to answer them. So have a little think and let me know. So a common question that I get asked is, do you need a prescription for cannabis? And medicinal cannabis is a prescription drug. CBD is a prescription drug. THC is a control drug. So you'll need a prescription for both of them. And also you need to have a really good chat with the doctor about what you need, why you need it, and the best program for you. So if you want to talk more about it, obviously I can't give any. Oh, here we go. I can't give any advice over, the internet, but book in for a consult, and I'd love to talk to you. Do I think CBD oil will ever be funded? I hope so. We really wish that it would be. We're optimistic in the next couple of years it will be. Will I have to stop all my meds first? No, you will not. And in fact, we recommend that you don't stop immediately anything like overlap by at least a month. And also bear in mind that your GP really needs to be integral to all this, so do always check with your GP before you stop any meds. But in our experience, lots of people do stop some meds or reduce them, or stop some completely. Is there a best method to take CBD? Yes, and the best method is to stick some. Well, you can have it in a couple of ways. You can have it as an oil, or you could have high CBD flower. So I'll talk about flower in another talk, but the oil goes underneath your tongue. You've got a lovely absorbent area under your tongue that is really good at absorbing medicine. So stick it under your tongue for 1 to 2 minutes, and then you're good to go. But although there is some research showing that if you eat something with a fat or an oil in it, then you're more likely to absorb it better and have more prolonged effects. Hang on, I'm just gonna scroll up to some more questions here. Ooh, interesting one, Daniel Chandler. What's the legality of being in possession of medicine or using medication out somewhere and being seen or smelt by authorities? Yeah, that's something that some of our clients have experienced, and sometimes people can be not too sympathetic. So you have a prescription. This is a prescription medicine, just like, if you were taking tramadol or something like that. And so in terms of the law, if you have a prescribed medicine and you're not doing something that involves impairment, so you're not driving while you're on lots of THC or something like that, then there's no reason why you should be penalised. You are within the realms of the law. So when you do get a prescription, we do give you a letter confirming your legal use. Let's just have a look. Yeah, insomnia, CBD or THC, good one, David. And so some people do really well on CBD for insomnia. Just people who just have a bit of anxiety during the day, and then the CBD settles down their anxiety. But really, I think if you really want to nail your sleeping, THC. Do we prescribe edibles? Well, we have oil. Does that count as an edible? I don't know, but certainly we love oral cannabis. It's absolutely brilliant because it's way more sustained in the system. Can you use the vaporizer and the CBD oil together? Yes, in fact, we love people to take CBD oil alongside their flower because CBD is very stabilizing. And really helps counteract any potential harshness or side effects from the THC. And CBD, wow, man, it's a fantastic background medicine. So I do suggest that CBD is a great mainstay. Oh, gosh, Thai, that's a curly one. I was wondering if you know the bioavailability of Tilray compared to swallow to sublingually. Well, I do know that the bioavailability is better sublingually. If you look at the graph of it, Ty, you can see it sort of goes like this for your sublingual absorption of THC, and it's more sort of like a bell curve for oral. But there is some evidence that if you have it with some food, then it does prolong the effect of it. Do we have CBD gummies in New Zealand? Well, we did, and we are waiting for some more to come in. We don't have any at the moment. Alan Oliver, we can give you a letter to give you proof of medicinal cannabis. Sorry, I'm just looking at this. Ooh, when are the new THC oils coming? Yeah, soon, hopefully. As you know, more New Zealand products are coming on the market, so we will be having some more options coming along, which is great. Do workplaces allow employees to be on a CBD or THC oil while at work? Oh gosh, that's a very curly question, Marseille, and the short answer is they should if you're not impaired. And the fact is that I think it's a really good practice to have a chat to your employer before you start on any kind of medicinal cannabis regime, and just to be upfront about it. And we're always happy to chat to these people or send out information for them, because usually it's an information thing, because, most people think cannabis equals like turning into Bob Marley, which, as you know, is not the case. So yeah, the workplace thing can be a curly thing, but one that, hopefully we're waiting for some more legislation around the government to clarify this for everyone, especially the employers, who it's really hard for them. Okay, just to follow up, that as a patient, I'm still allowed to drive with it in my system. Well, the THC stays around in your system for a long, long time. Your hair will test positive for up to 3 months. It's crazy, isn't it? So as long as you're not impaired, Daniel, then we recommend that an 8-hour window, and then to reassess how you feel. If you felt in the least bit out of it, you should not drive, okay? But if you're feeling good, yeah, you should be fine. THC is great for sleep, yes. What can you tell us about CBD or THC for treating depression? Yeah, gosh. Well, I'm going to talk all about this next time I see you, Brad. So I'm going to go all into the sort of science of that. But what I can tell you is, in our experience, CBD and THC can be very, very helpful for depression, because it increases your serotonin and your dopamine levels, and it also decreases all your fight-flight hormones. So I'll have a chat to you about that next time we meet. Can you travel into other countries with CBD oil? Oh, that's another great question, Kylie. The answer is, it depends on the country. And I highly recommend that before you go anywhere with any medicinal cannabis product in your pocket. And of course, we can give you a travel letter, but that won't cover you if, for example, you go to Saudi Arabia. They're super hot on it. So you should always check with customs. Australia, as far as I know, is absolutely fine. If you never received a letter, Catherine, you can ask us for one. We can give you one, absolutely. Does CBD or THC help with cancer patients? Yes, absolutely, it can do. In our experience, it can really help with mitigating symptoms of, from going through chemo. It can be very, very helpful. And of course, it's an awesome pain reliever, good for anxiety. And in our experience, it just helps to decrease general stress. Can this treatment with you be funded? Not at the moment. Sorry, Kayleen. Some people do get some WINS funding, but there's a whole lot of sort of rules around that. So it just depends on where you're at. But at the moment, nothing from the government other than that. Do you have TCBD? Yes, Margaret, we do. And it's amazing stuff. Yeah, really interesting, because it although it might give you a tiny bit of a buzz, it won't impair you in the same way that a THC flower will. And it gives you lots and lots of CBD. And to my mind, CBD is the way to go. Oh gosh, Rachel Harris. Yes. So we have been working with some people who've been vaccine injured, and that's a really, really big topic, and I will talk about that in the future. But yes, absolutely. In our experience, we found it is helping. Do I know where shushkaberry is grown? Ty, you've got me there. Now Ben, who's watching, he'll know. He'll probably know the field it's grown in. He knows so much about medicinal cannabis. He's the amazing nurse specialist that we have, and he's like my personal guru of medicinal cannabis, so he should know that, so maybe he'll tell you. You don't get high on CBD? No, Pamela, and my teenage clients are always so gutted about that. But no, well, having said that, of course, if you take enough of anything, perhaps it can make you high. And also if you take it in conjunction with other medicines that CBD can, potentiate, can make the effects more pronounced, such as benzodiazepines, then for sure it could make you feel a bit impaired. But on its own, nah, at the doses that we prescribe, not at all. Will the letter allow you to skip drug tests for work? Oh, Matt, no. Oh, thanks, Fabian. That's awesome. Thanks. Yeah, Canada. Okay, cool. Will the letter allow you to skip drug tests? No, you'll still have to go through drug testing. And I would suggest having a chat to your employer before you start any. What would you recommend for anxiety? Oh, Tondi. Well, I think that CBD is a good starting point. for sure. But you need to chat with someone just to really talk about what you need, because it's so, the whole thing about cannabis medicine, it's so individualized, and that's the beauty of working with everyone individually. And I'm always learning, because everyone is so different in their response to medicinal cannabis. I would like to try the gummy. Yeah. So gummies aren't available at the moment, but in the future they will be. If you don't like the stone feeling, oh yeah, you should totally talk to your doctor about that. Will we ever be allowed to grow? Yeah, I really hope so, Craig. I really hope so. Gosh, we've got lots and lots of varieties of cannabis flower, but I'm not allowed to talk about them. We're not allowed to be advertising in any way, so you need to talk to a doctor about it, Alan. Yeah, ADHD. Yeah, wow, that's something that I see quite a lot of people for. In our experience, it can be very helpful. It can help to rebalance all those hormones that are out of whack with ADHD, your neurotransmitters, and so it can help you focus and just slow down, and also helps with anxiety. So yes, Alina, but book a consult if you want to have a proper chat. Yes, if there's a history of psychosis, again, Kayleen, good to chat with us, because really it's a case-by-case thing. You know, there's been a blanket rule, no medicinal cannabis if you had a psychosis, but really that only really applies to THC. And I think it's always worth talking to a doctor about the CBD option. And if you're really, really stable, then perhaps you could have other forms of cannabis as well. Gosh, the requirements to become a patient. Well, get in touch with us. We would always love to see you, and we can have a chat to you about, whether this will be right for you. So, hang on, I'll do one more. What if your doctors won't give a prescription? Well, come and talk to us, and also encourage your doctor to get educated. And we're working hard on becoming an education service as well for doctors, and so that doctors feel more confident prescribing, because half the time it's just because they don't really know what to prescribe. And with more information, it becomes something that's pretty easy to prescribe and to monitor. It just takes a bit of experience, so we're always happy to educate GPs. All right, well, we're up to 7:30 and the questions are still coming. So I look forward to seeing you all the next time. I think it's going to be in 2 weeks' time, and I promise that I will have tamed whatever's happening with my lovely iMac, which normally works so perfectly. I just chose this moment to have a bit of a blank moment. So thank you all for tuning in, and thank you for all your questions, and thank you so much everybody for just being awesome. I love working with all of our clients, and this clinic. It's so super friendly place. So if you do have questions, if you want to have a chat about whether this might be right for you, then do get in touch. And we're a very friendly, approachable clinic. So next time, just a reminder, I'm going to be talking about how medicinal cannabis actually works, and the different forms of medicinal cannabis that we use. So I look forward to seeing you all there, and I wish you a very happy and healthy fortnight, and I'll see some of you in the meantime. So I'm signing out now, and I'm wishing you all, lots of health and happiness. Bye for now.